We follow the standard precautions, transmission-based precautions, and we also give importance to occupational health. What does not work or what leads to the failure of infection control programs? Now this is one of the study which tells you, okay, this was some views, okay, this was actually published as a study. These authors are basically the nurses. Okay, if you look at these points, you would know these are our voices, something which we wish to say loudly, but yes, so these are the screenshots of that. I have just taken the few points from this. So we would say that many of these were actually the direct interviews, so it is just copied in that manner. Okay, so don't take it personally, these are purely from study. Okay, so it says that the management wants to comply with the IPC measures that they themselves are not adhering to. Many of us do say this. Okay, so yes, and so they believe that the management also needs to be educated just like them. And they say that the hospital management does not care, there is nothing, when they address the issues, they are not looked upon, okay? There is too much resistance when, yes, we also know this, at least those people who have worked towards establishing an antibiotic stewardship program and the IPC programs know there is a lot of, trust me, there is a lot of resistance. Unless and until that each of us pledge that, yes, we can make a difference or we feel that we can make a difference, we actually cannot do anything towards it. Okay, and then many doctors say that these staff nurses do a lot of, they do not know anything. It's a blanket statement. Probably it's not right to give a blanket statement because they do a mistake. Again, so the nurses do wrong wound dressing. They do not know anything. Okay, and again, having cockroaches, there are many hospitals do not have an isolation facilities. So what I'm just trying to say with this is that we are not the only institute or we are not the only country struggling to establish an IPC program or an antibiotic stewardship program in place. So there are other countries equally struggling with that. So in nutshell, these are the things, so we should have, lack of knowledge and lack of positive attitude is what is stopping the infection control program, and inadequate infrastructure, poor hospital maintenance, inadequate resources, but again we have staff shortage, that is human resource and other material resources, inadequate education and training measures, and emerging pathogens adds top of everything. And these are my references, and thank you so much. I take this opportunity to thank the organizing committee, Dr. Sandeep Agarwal sir, Dr. Nikhil Varghese sir, Dr. Smriti, and I think Dr. Indranil Rath. Thank you so much for inviting me to this talk and being part of this informative session. Thank you so much. And thanks to the chairpersons who have had the patience to listen to this. Thank you so much.